speakers for our webinar series. Reaching out to families with autism is difficult within the big cities that many of us practice in. Getting to these families in rural areas is an even bigger problem and a real nightmare for many people. Our ATN AIRP site in Arkansas has a lot of experience working with this because Arkansas is such a rural state. So we're very fortunate today to have Jane Belando, our behavioral science lead, and Angelita Giles, our family care navigator, giving us a presentation on how to better serve children with autism in rural areas. I'm going to turn this over to them now, and I'm concerned, well, we'll see if we hear them, okay? So I'm hoping that we haven't lost them. Jane, Angelita, are you folks there?
We're here. Can you hear us, Dan?
I hear you. Excellent.
Okay,
Thanks.
great. Thank you all so much, and thank you for taking time out of a busy Thursday to spend a little bit of time listening to some of the things that we have been working on and trying to develop to serve all the wonderful families and children in our state. And since Audrey is in control of the slides, you will be hearing me say next slide. So that's the next slide, Audrey. And this is a picture of Angelita's lovely daughter, London, because we always want to make sure that we are keeping our eye on the goal. And the goal is all of these children in Arkansas, but all over the state and all over the world that need our support and need our help. So we feel like if we're able to kind of direct our compass that way, that we have a better chance of succeeding in doing that all together. So just very quickly, I want to talk a little bit about the objectives that we're going to try to get through this next hour, because we really want to highlight the health challenges that we see in rural populations, and also specifically for children on the autism spectrum. And then we want to spend some time talking about programs that we've developed in our state, which is a very rural state, to try to provide services to individuals. Next slide. One of the things that we're very proud of is that we have a very active family advisory board. We call them the FAB. And so Angelita is going to take time to describe the parent programs that we have here. And as you're listening, we want you to try to see the successes, the challenges, and hopefully this will be a way to sort of help you brainstorm things that you might be able to do in your state, in your town, your portion of the state to help drive services as well. So with that, let's get started. And of course, in any presentation, you have to have the obligatory definition. And so this is our definition of rural. You know, when we look at the United States, at whole, about 20% of individuals in our country are in rural areas, and it's declined a little bit, but that is a large number of our population. Next slide. When we look at some statistics about what are some of the economic indicators for individuals in those rural areas, we see some things that definitely are challenges for these individuals. There is a slower economic growth, and as we saw on the last slide, there is a slight population decline. Poverty is a real challenge, and especially for individuals where there is this poverty, there's a significant amount of poverty. We're seeing particularly children and families being in poverty, and especially minorities and ethnic groups having a higher amount of poverty. We also see, not surprisingly, single-parent families more likely to be in poverty. The next slide, Audrey. When we look at education, and you know, you hate to make this a dismal picture, but you also see, along with hand in hand with economics, we see educational challenges as well. We see that there's lower educational attainment for many individuals that are in rural settings, and that for those individuals that are unemployed, not surprisingly, they're the people with the least amount of education. And you also see a lower attainment of educational goals for individuals in rural settings, which again goes hand in hand with those child poverty rates. Next slide. Looking at, I thought this slide was interesting. In the Texas A&M has something they publish every several years looking at public health initiatives, and they had a panel of national and state rural individuals who work in rural areas of state list the priorities that are needed for individuals who are in rural populations. And the ones that I've put up here, you can certainly go to the website and get the complete list, but I feel like the ones that I've mentioned here are certainly pertinent to our conversation today, because there is a lack of health care and a lack of mental health care, a lack of education and the community programs that are needed to really support families and children, and certainly the child health care needs. There's a lot lacking for individuals in rural communities. Next slide. Specifically to autism, there wasn't a lot out there, but what's out there I think highlights the challenges for families that are in these rural settings, that when you look at rural versus urban, that individuals are going to get a diagnosis about 5 months later than a child in an urban area, and for children that are in more poverty level in the rural areas, their chance of getting a diagnosis is going to be about a year later than individuals that are closer to centers where they can receive those evaluations. And certainly the AAP has expressed concerns not only about autism, but about subspecialists who are working in rural areas and really sort of putting out the charge that there needs to be more support, more education, more access to care for families in these rural areas. Okay, next slide. One article that I found I thought was scary but interesting, when looking at mothers who in a rural setting that completed something that we all know and use frequently, the MChat, that the internal consistency and that should be actually low maternal age. So for younger mothers or mothers that they defined as minority, that there was lack of consistency in completing the MChat, and that many times that the autism symptoms were over-reported. So I think it makes a double concern in that maybe individuals are not understanding what they're asked to complete. And if we have practitioners that are in these rural communities that maybe don't have the expertise to sort of cull some of that out and ask the pertinent follow-up questions, that there may be frustration or concern from the practitioners in diagnosing. So it looks like there are additional challenges just besides the education level and poverty that we've already talked about. So next slide, please. You know, from our clinical experience, I wanted to say some things also that I think that we see that I was in a very rural part of Arkansas last weekend. The name of the town was Turkey Scratch, and believe it or not, that is really a town's name. When you go through the downtown, with all of the buildings were empty. The only buildings that were really kind of viable were the Dollar General stores. And we see that scenario many times and hear that scenario when we have families that come 2 or 3 hours to see us here at our developmental center. And some of the things that we also hear from families is that their child did qualify for occupational therapy or speech therapy, but the one person in town has quit, and so there's nobody to provide those services. For myself as a psychologist, I follow some children for therapy. I have many stories of parents showing frustration that they get a diagnosis, they're hoping for an IEP, but because teachers or principals don't have the experience or don't have the expertise in the area of autism, they really have a hard time implementing what should be on their IEP. And just as importantly, not having support groups or other families in the community that can help walk the walk and sort of walk the journey with families. So those are definitely very real challenges. Okay, next slide. I don't need to go over this in detail, but what I did is I tried to go through and get a sense of, for all of our ATN or Autism Treatment Network sites, what is the percentage of the population living in rural areas? And certainly at Arkansas, I think we win on this one. Almost, you know, over 40% of our individuals are in rural areas. But certainly Tennessee and Missouri are facing some of the same challenges. And I know we have spent a lot of time talking with our colleagues in Missouri, and we commiserate with the challenges that we have. Certainly Ohio, Pennsylvania have about national average, and New York, Massachusetts, and California. I know that you all have, maybe not as much rural, but you also have children with health disparity that have other issues that you're dealing with and problem solving and trying to support families. So next slide. We want to talk a little bit about the kind of things that we have done here in Arkansas. That we have a small group of clinicians that work in the area of autism, but you know, I have to say I feel like we have incredibly dedicated individuals who are willing to think out of the box and who are willing to go to our state legislators and our state providers to try to help partner, and hopefully we can help share some ideas that may jog your problem-solving skills as well. So let's start with our first slide, and I just want to show you the state of Arkansas and show you all the green that is there, which is rural areas. And if you push the slide again, Audrey, there we go. The heart is in, that's where we're at right now. We're in the center of the state. We're the capital of Arkansas, Little Rock. And we have children and families coming from all over the state. We are the primary assessment developmental disorders diagnostic center. So you can understand all the challenges that entails for families trying to get here. Many families don't even like driving in Little Rock, and for some of you in larger cities, you're going to shake your head because if you came here, you would know this is not a large city. So for some of our individuals that live very rurally, this can be a scary place to be. So next slide. And again, just for comparison, when we look at the U.S. mean income, which is close to $50,000, you look at individuals based on areas of our state, especially in the Delta, and they call the Highlands, which are some of the poorest areas in the country. So there are challenges for our families that we always have to respect and be very aware of when we're talking to them about recommendations and trying to help them access services. So next slide. Also, the lack of pediatric care is a reality. On this slide from the Arkansas Health Task Force, you can see in that area, the Region 7, which is the Delta area, that we have very, very few pediatricians. And actually, we have very few pediatricians in the entire state, and not surprisingly, they are primarily located in the two main urban areas, which is Little Rock, and then also the area around Fayetteville, Bentonville, where the Walmart, the Waltons have their empire. So next slide, please. One of the things that we feel like is very important to realize is that there are more family medicine physicians. When we were at the ATN steering committee in DC in June, this was a really, really important discussion point that I think was sort of an epiphany moment for many of us in our group that talked about rural issues, because we really need to be tapping our family medicine physicians. We know that our pediatricians are invested and want to help, but we need to enlist the larger number of individuals that are in these rural settings. And as a as we're affiliated, we are part of the faculty in the med school. We, we have family medicine residents that rotate with us on our developmental behavioral rotation, but usually they're here about a half a day. So they may be getting a little bit of exposure, but not enough that we think that they are going to feel comfortable and confident in being able to help understand developmental issues. And we need to target our colleagues in family medicine. Next slide. Each ATN site is going to have a different distribution of minority and how that gets defined. So we know that there's not going to be one size fits all. And we certainly have figured that out as we have been privileged to be a part of the health disparities work group through ATN. So we want to clarify and just sort of have the caveat that the things that we've done here are going to work for our sort of race distribution. And we know that each ATN site, each state will have to make sure that they're tailor-making it to fit their own needs. So, okay, next slide. So we want to just start going through some of the things that we have created here. Some are things that are state grants, but again, hopefully that this will help spur some ideas. So next slide. And we feel like one of the things that ends up being very, very important are relationships. That it may be easier in a smaller state because there's not as many of us, but we feel like for whatever reason, the relationships we have with other major entities, major players, the Title V, the DHS, the child care aware individuals have really allowed us to partner and enhance our programs and to do things that we're proud of, and we hope that we'll spur some ideas for other people online. Okay, next slide, please. And rather than waiting to the end, I thought I would go ahead and do a what have we learned so far. And we know that our driving goal, and I think for everybody on this webinar, is that we need to help provide the services and the education and the follow-up for children. None of us can do it alone, and we need to make sure we're working smart. And the leveraging is the best way that we can get the most bang for our buck, for time and effort. And certainly as we kind of see how the world is going to change in terms of money and time and effort for healthcare, those things they may very well become more salient and more important. Okay, next slide. We feel like we've had some successes in what we've done, but some things that I think that are challenges and need to be highlighted is we want to make sure we're steering away from a model of just dumping information on to people and then not sustaining, not mentoring. We also want to make sure that we're being careful about targeting the populations that need help and understanding the challenges, just the getting from point A to point B, the money of getting gas, hotels, people being suspicious of the big cities, and really developing trust and liaisons in that people's communities, because that's the way that we're going to be able to do a job and do it in a much better way. So next slide. So as we're talking, we really want you to be thinking about what we're saying, but more importantly, thinking about how you're able to build your own infrastructure and harness the accessible expertise. So with that, I'm going to start talking about, we'll go to the next slide, and I'm going to start talking a little bit about some of the things we've done. And one of the first things that I want to briefly talk about is our developmental outreach clinics. And this is shepherded by our section chief in developmental behavioral pediatrics, Dr. Eldon Schultz. So next slide. And with all these slides, I've wanted to put who we've partnered with. So this is Outreach Clinic, and this is funded by our Title V Children with Special Health Care Needs money. And so we have, you can see where the stars are, we have outreach clinics throughout the state that our DBPs and RN and social worker go to each site 3 or 4 times a year. So we're able to do screenings for families, to do follow-up appointments if they've been here for an evaluation. It helps. Families are very appreciative that we're able to do that. and we're able to serve about 110, it seems like that's a low number, but at least that number of children a year that don't have to come to our center, and that ends up being very helpful. Okay, next slide. LEND, I won't go over this a lot because I think most of the people on this call probably understand what LEND is. You can see the individuals who have this grant for us and champion it every Friday and every year every time that the grant renewal comes up. And Audrey, next slide. But just for the ones who may not be as aware of LEND, that it's graduate level training, and it's multidisciplinary to help really help these different people in their disciplines assume a leadership role. And this funding is from HRSA and Maternal Child Health Bureau, and we are always very grateful for their funding and helping us train our students. Okay, next slide, Audrey. This is a sort of homegrown program called Cobalt, and again, Dr. Eldon Schultz and myself and one of our colleagues are shepherding this and very excited about Cobalt. And if we go to the next slide, we can kind of give you a little idea. We know that there are many families, many pediatricians, many physicians who are concerned about a child and if they have developmental delays. And if everybody's coming to our developmental center, we have sort of a traffic jam. And so all of a sudden then it becomes a year, 18 months before families come in, and we actually become the problem rather than the people trying to help. So what we are doing is we're creating these little mini teams around the state. If we think about it, they can diagnose autism if they want, but what we're really hoping is that they can diagnose what's not autism. So if we're able to help these teams do a more rapid screen and help children get into early intervention, early childhood services, get DDC case management, and then if they have to come to our developmental center, they can. But we're working very closely with Title V to help create this program to screen and triage children to get them to the right services at the right time. So next slide, Audrey. When you think about what do these mini teams sort of look like, we handpick our pediatricians. So these are folks that are seasoned, that we know well, that we trust, and they are paired with one of their speech therapists or a behavioral therapist, and they come to our center, and then we have a very intensive 3-day training. So we do lots of didactics about autism and helping them understand about what autism looks like, the comorbidities, teach them about the Autism Speak toolkits. The second day, we also bring in the early intervention, early childhood, DDS individuals in their area so they are able to see them face-to-face in hopes of creating that relationship. One of our first times that we did this, we had the physician and the early intervention coordinator look at each other and say, oh my goodness, we go to the same church and we never knew what the other one did. The other thing that we do is we teach our pediatrician, our Cobalt teams, how to do more specific developmental interviewing, and then we use a screening tool. It's the Autism Detection in Early Childhood. Teach them that, and then we bring children in and we allow them to give the ADEC with our supervision and then start talking about the logistics of creating these teams. So it ends up being a pretty intensive 3-day training. Next slide, Audrey. And you can see we have right now 11 teams currently, and we've had over 200 children that have been through these Cobalt clinics, so we are helping get kids into services more quickly. Next slide. Thank you. We're very happy that we've had a lot more money come into us from Cobalt, and so this is allowing us to do some things that we have needed to do. But one of the things that I wanted to talk just briefly about is a website development. That when we were in DC for our ATN steering committee, I think I mentioned that we were talking about the importance of getting family medicine docs involved. On my way back, I was in airport, we found out we were getting this large amount of money, and so I was able to say, why don't we develop a website that can be a resource for family medicine docs, APNs around the state to start helping educate. So I feel like this is the first step of sort of changing the boat, the course of our boat, to start including other professionals. We're very excited about all of these additional things that we're able to offer that you can see. Okay, next slide. I'm going to talk very briefly about Echo Autism for people on the site who are ATN sites. You know that this is a program that's been spearheaded by AIRP money, and Kristen Saul and Micah Mazurek at the Thompson Center are heading this up, and we are starting our Echo Autism work actually on this coming Monday. And the whole goal of Echo Autism is to move education, not move people. So by telemedicine or teleeducation, we're going to be working with physicians around the state doing case presentations, case consultation, and didactics about autism, and we are delighted and excited to get started. Next slide, Audrey. This is our team, and one of the people that I want to highlight is the last name here that Betty, she actually goes by Kay Baudier. She is the director of Title V in our state, and I have to give our ATN lead, Dr. Lopez, a huge thumbs up, because getting Kay Baudier on our Echo Autism has been wonderful, because she knows the resources in the state, but we're also getting huge buy-in for all of our programs, and we feel like it's just deepening the relationship we have with her and with Title V. Next slide. We want to go through, we have another grant that we have. It's called Healthy Child Care Arkansas. And for some of you who are AAP members, you've probably heard of Healthy Child Care America. And we have the grant that is doing the same work in our state. Next slide. That we have had, we've gotten a lot of money from Healthy Child Care Arkansas, and so we certainly are doing consultations with child care providers in terms of health and safety, and if anybody's interested in looking at our website, I've put that down as well. If we go to the next slide, just a couple of programs that I want to highlight. One of them is, we call it SPAKES, Spotting Autism in the Early Child Care Setting. And if we go to the next slide, Audrey. Thank you. That this was actually a $2,000 grant we got through AIRP money that Dr. Lopez, Maya Lopez, and we created a 6-hour workshop, and we went around the state training child care providers about autism. And when we were able to get this grant, the Healthy Child Care Arkansas, we turned that into an online training, and it's free to child care providers, but really free to anyone, and they're able to get continuing education credits, which are really important for child care providers. If you go to the next slide, Audrey, we just launched another web training that is called Managing Challenging Behaviors. And again, we gave that live around the state, and now it is a web-based training, so we are able to provide that information to child care providers and really anybody as well. This coming year, we are doing a workshop for child care providers on how to help work with parents that can be challenging or not as engaged. So we're working on that now. Next slide, Audrey. I just wanted to kind of give you some numbers for this as well. We're very proud that you see that there are a lot of individuals who have completed these trainings, and you know the SPAKES is 6 hours, so it can be kind of daunting, but we feel like that people are using these and it's helpful, so we're very excited about that. Okay, next slide. I just want to mention that we have representation on our legislative task force. So again, trying to be in the room with people who are making the laws and making the legislation for individuals with autism in our state, and Dr. Tyra Reed is our faculty representative on the task force. We have been able to get an applied behavioral analysis and ABA waiver through this task force, and we feel like that's probably the biggest accomplishment that we've had so far, and are feeling very, very, very good about that. There's a long way to go, but we're proud. Okay, next slide, please. And then the Autism Treatment Network, and these are individuals that are primarily involved. And we'll go to the next slide. That we know probably most of the individuals listening know what the ATN is, but we just feel like we wanted to say a thank you, because being a part of ATN has really made us a better site and able to grow and reach out to our families, and hopefully nationally. So it has been a wonderful experience, and has allowed us to do things for the children of our state. Next slide. This past August, that spurred by ATN and trying to, the importance of getting information out into our state about the kind of things that the Autism Treatment Network does, that we partnered with our local hospital, Arkansas Children's Hospital, and we called it a town hall meeting. So for the ones of you who've been to professional conferences, you know how people have poster presentations. So we had 15 posters around a large room, so people were able to come, and we had a lot of families, but we had professionals and teachers to come and look at the different programs that are available. And then we had a couple of podium presentations, and we had actually Angelita's daughter, her cheer team did some cheers, and so it was a very rewarding experience. Okay, next slide. I'm going to be quiet and let my wonderful colleague Angelita start talking about some of the more parent-led programs.
Thank you so much, Dr. Jane. I will be talking about our TeamUp Conference. I can honestly say, as a family care navigator here at the Dennis Developmental Center, I've enjoyed myself in that role, helping families, but being a parent of a child on the autism spectrum has really taught me so much. And I can say that this team up, that's what the word team and team up really just identifies what this site is all about. As you can see on the slide, it lists Dr. Lopez, DDC clinicians, Autism Speaks Arkansas, and our Family Advisory Board. Next slide, please, Audrey. Our TeamUp Conference, we actually have it biannually, and we include everyone on the planning committee. It's organized by volunteers. It's funded by AIRP money, ATN, Rockefeller, private, mainly registration fees. And I also want to add that we are also able to give out a few scholarships for parents. So that's also a great component, especially being that we're in a rural state. And that is something that parents always mention, that when it comes to finances, and Dr. Jane mentioned it earlier, being in that poverty level, because we're able to provide that, more families are able to come. It's a statewide conference on ASD, and as I mentioned, we have it every other year. It's a conference for parents, teachers, MDs, RNs, PhDs, SLPs, OTs, PTs, administrators. The good thing about it is the teachers, the administrators, the doctors, they do get credit for coming. The national experts and local experts come to our conference, and it's, as you can see to the right of the slide, Kerry Margot is a very familiar face. He actually came to our team up in 2013, and I can just honestly tell you, from a parent's point of view, having Kerry there saying to moms and dads and caregivers that I could not talk until, I can't remember the exact age, but I know it was later in his, maybe later as 7, 8, or 9 years old, for him to say that now I am a public speaker that is something that really just captured the hearts of families. And so when we're sitting down and we're planning the team up, and it usually takes us about a year. We usually start about a year ahead of time, just kind of talking. And as I mentioned before, we include everyone. Anyone that wants input on the TeamUp conference, they are asked if they would like to have input to come to our meetings. And so it's also a combination of educational and medical topics. And our next team up is in 2017, so we've actually already started planning for that. Next slide, please. So for our goals of TeamUp, I have here listed empower, listen, build relationships. One of the great things about our TeamUp, we have a resource fair. And so throughout the entire conference, there are resources from pretty much every type of community resource that's all around the state of Arkansas. They come out and they have their station set up, and the parents love it. Not just the parents, but also the clinicians. It's just another way for us to know what is out there so that we aren't doing separate things, but that we're kind of tying everything in together. So that's something that we definitely appreciate about the TeamUp conference. One thing that we say when we empower, there is a parent, a guardian, a grandparent that they're just waiting for the key. They're waiting to speak on behalf of their child. So this conference, we want them to have that voice. I can just remember when London started here at the DDC, and I mentioned to her developmental doctor, who just so happens to be Dr. Lopez, that I wanted to be an advocate for my child, you know, and how can I do that? And she said, well, I'm willing to help you do that. And so that's something that I'm so proud of, being a part of this wonderful, wonderful team here in Arkansas, is that I believe the world of medicine is changing. It is evolving because the doctor and the patient relationship is getting closer and closer and closer. I hear all the time as a family care navigator, parents are getting more comfortable talking to doctors, and they're doing that because at conferences like these, the doctors are walking around, they're able to stop, they're able to ask questions just to kind of build that relationship, and that's something that we hope to really just get that out there for all the parents when they come to TeamUp as well. Next slide, Audrey, please. So here is where we come in with the parent-driven programs. I want to also mention, you know, again, it was Dr. Lopez and Dr. Jane and other doctors here. They continue to water that seed so that other parents like myself, we can continue with our programs and help the parents, help reach parents. So our goal, we think about family, we think about education, and also community. Next slide, Audrey. So with family, it is our goal to connect. It is our goal to empower. One way that we connect is we ask, what is the need? When I first began on the Family Advisory Board, you know, there was a lot of conversation about the what ifs and what should we do in the next steps. But what we started to do, we would send out Facebook posts. You know, nowadays, that's what most people are doing. If they don't do anything else, they do Facebook or other avenues. So we ask questions, what is your need? We just don't assume that because London is on a different place on the spectrum. So I can't assume that her needs are the mirror of all the needs of the parents. So that's one of the things that we do for our goal with the parent-driven programs is we want to know what is it exactly that our parents need. We also try to reach those parents that we feel that some sort of way fall through the cracks. They kind of get lost in the shuffle. They get the diagnosis and they're not heard of. If they are blessed with a doctor like I have who will follow up, sometimes we don't hear from them again. And it's amazing because when I run into parents, you know, I ask them questions and did you hear about this resource? Did you hear about this resource? And I'm always surprised that there are parents who their children were diagnosed well before London was diagnosed, and they haven't heard of the information. So that's something that what we're trying to do as we're connecting, as we're getting the needs of our families, is we just want to make sure that all of our families are getting reached. Now, it's not perfect. We're not saying that there are still some that we haven't connected with, but we just want you to know that that is a main goal as our parent-driven programs. Next slide, please. With education, one of the things we wanted to do and thought was important, we thought bridging the gaps. There is a huge gap between the clinic and the school setting. We find that sometimes our doctors and then our teachers and the administrators were not on the same page. So that is something that our parent programs, what we looked at, how can we bridge that gap? How can we close that in? And then providing professional development. One of the things that I'm most proud of, and the other parents that we do here, is we actually do go into the schools and we do provide professional development, because let's just face it, there is just a lack of knowledge. Doctors write notes, and sometimes they do think that just because they wrote a note on behalf of their patient that the school is going to automatically take care of that or do it. And so just closing that communication gap is something that we're doing. And also, as a liaison, myself, I just started the conversation with the administration here in Little Rock. I sent an email to the superintendent, and I'll never forget, I was actually on a call with our FAC, our Family Advisory Council, and we talked about those concerns about infiltrating the school system. What would that be like? Would they welcome us, because we all know that school systems, typically, they use their own resources, and because they use their own resources, they typically don't allow outside resources in. But what I did, I came from a parental approach with the superintendent, and I just kind of emailed my heart and just said, listen, I want us to work together. I believe I have some expertise that I would like for you to know, and I know you have some expertise that will be beneficial for my families that I'm serving here at Dennis Developmental Center. So from that, the Parent Advisory Council was started here in Little Rock, and so it includes myself and other special needs families. So that's another way that we just, as parents, we came together and we said we have to be a liaison and bridge that gap between the school and the clinic setting. Next slide, Audrey. Community resources. Okay, this is one of my all-time favorite things. It is so important. I think we have done it as a FAB. We sort of divide and conquer when it comes to providing resources and activism. Not only are we on the board, but we make it a point to make sure that one or two families that are on the board are a part of several of the different community outlets. So as Dr. Jane mentioned, the Legislative Task Force, we had a few families that participate on our FAB that were a part of that. We also have a parent on the Advisory Council, the first responders, and it is also a top priority for us to really have that relationship with our local walk committee. Our walk chair, she is actually another board member on our family advisory board. And so again, as Dr. Jane mentioned earlier, just tying in those loose ends to just bring us all together. So that's one of the things that we do. Also, we attend workshops, not just locally, but we also attend workshops in other states so that we make sure that we are ahead when it comes to providing resources for our families. Next slide. All right, so this is Project PAC, Parent Advocates for Awesome Kids, and that is yours truly over there in that picture to the right. But yes, this program literally started in 2012 at my follow-up appointments after London was diagnosed with autism in January of 2012. And I'll never forget, Dr. Lopez said to me, she said, you have such a positive relationship with your child. What do you do? And I said, right now, I really want to just be an advocate for other parents, because when I walked out of here in January, I didn't know what to do. I said, so I want to help parents that don't know what to do. And she looked at me and she said, well, let's do it. And I was thinking to myself at that time, are you kidding me, this doctor? Because that's what it is. We as parents feel like we're down here and clinicians are up here. But one thing that I can say about this wonderful team, they literally they make us feel just it's an even playing field. We're all in this together. And because she watered that seed that was already in my head that I wanted to be a blessing to other families and, you know, guide them through the process, she said, let's do it. And I couldn't believe it. She called me the next week. I didn't think she would ever call me, but she did. She called me the next week. PAC was birthed. We wrote a grant, and we were funded. And so when there's a developmental concern for a child, if a parent has any concern, even if that concern never even gets close to autism, we want families to take back their power. I experienced that. I had questions about London, but people kept telling me, oh, your cousin had that. Oh, your uncle had that. You leave London alone. She'll grow out of it. Leave her alone. But I want parents and caregivers and guardians to know if you have a concern, you have every right to advocate for your child. Small seminars, SPY families that help families become stuck, and you see these lovely people below me. Again, I was just a mom wanting to do something great, and they said, well, we'll help you. And so we had our first session, and parents came out, and they just asked questions. You know, I think he may stutter, or I think he may have a behavior problem. Even if that thought is in your head, this is what I can do to help you. Go to your PCP, talk to your PCP about that concern, get a referral, and go from there. I'd rather you think and there be nothing, or think and then there's a time lapse and you don't get the help you need. Will help to figure out where to go, get an appointment, get the resources needed. The beautiful thing about PAC and the support of Dr. Lopez and Dr. Jane and the other doctors here is they understand that our parents have different needs. And so, yes, I've accepted calls late at night because I understand for some parents, they could not get their child to bed until 10 o'clock at night. It doesn't happen all the time, but that was what our focus was with these parent-driven programs. We wanted to meet the needs of the families. Next slide, please. And so some of our accomplishments to name, we provide professional development. I've gone into the schools with Little Rock School District, and I've did a training called Bridging the Gap, Fostering Relationships Between Parents and Teachers. And that was just a training that for me to just show teachers how to open up to families. Again, mentioned the liaison with the school district. The Mom's Makeover Day is something that I'm very proud of it, but I couldn't have done it without the help of my support here. But about 12 moms were nominated by clinicians, by teachers, special ed teachers, and just other moms to get a makeover. And we did a makeover. They got their hair done, they got their makeup done, they got massages, and we just had a good old time. Strike Out Autism, as you can see in this picture, we had 88 bowlers and about 120 participants all together, and I partnered with the ATN and Developmental Center, and we just had an afternoon of bowling. Families who are afraid to bring their kids out because they think they make too much noise or they get overstimulated were able to bring their kids out and just have a good time. Next slide, please. Autism Arkansas. It's also another parent-driven program that we have. In our rural area, we have a high population of Hispanic and Latino families. And so Suzanne Mancera saw that need, and so she's been going to health fairs. She's partnered with the Mexican consulate. She does awareness pretty much all over Central Arkansas, and she has been a blessing to the Latino community. Next slide, please. She also assisted with the opening of the ACH Southwest Clinic, and she serves 5 to 7 families a month. And again, she attends minority fairs across Central Arkansas. So it has really, really helped our families. Next slide, please. Next There we go. And Autism Connections, the chair of that group is Teresa Danaway, and it was started in 2012 as well, and it meets once a month, and it's a new group that was formed around Central Arkansas. They've gone on field trips. To date, they have 161 members on the Facebook page, but again, it's a support group for families to come and just kind of share their load. You know, we're all in this together. Next slide, please. And want to talk about the UAMS in-house grant, and it was submitted by the Family Advisory Board, and we did receive $5,000 to update our Developmental Center waiting room. So when parents are having to come and have lengthy appointments, their kids have an area where they can play and have fun. Next slide.
This is my nephew, who is now 17 and would probably be mortified if he knew that I was showing this slide. I know that many times it's hard to have discussion on a webinar like this, but if there are any questions, you can either email us or type in. But thank you so much for listening. We hope that this has whetted your appetite and maybe help you think out of the box a bit. And we will open for questions or let Dan or Audrey do some concluding remarks.
Thanks very much, Jane and Angelita. Wonderful presentation. Audrey, do we have any questions?
We don't have any questions right now, but if folks, have questions, we have a couple more minutes. You can, type them into the questions bar or unmute yourself for discussion.
I have a question. I was very impressed with how you've developed this website as a way of trying to get information out there and communicate better with all of your families in the rural areas. How is that being received? Are they using it? Do they have internet access? Because using some of these new technologies for communicating, the traditional phone call to the doctor's office or from the doctor's office. Now we're seeing a lot of texting. We're seeing your health portals that are tied to the health record, electronic record at your physician's office and so forth. And families don't always seem to want to use some of these technologies, and some of them don't have the access. So can you give us a little more description of how well that's going and being accepted?
Absolutely, Dan, and I can tell you right now it's a work in progress. That we found out that we had access to, we got this huge grant back in June. So it actually, we're still in the process of developing the grant, developing the website. But one of the things that we were trying to do is be very respectful to some of those issues that you're talking about. So as we've been trying to dream this, one of the things that we knew is that we were going to have to make it certainly a lower reading level, but we needed to make it not so many words, but we needed to be visually pleasing. So one of the things that we have done is we've partnered with some of the IT computer science students here at our local university, and it's their creation of the website is they call it their capstone project, basically their thesis, their end product. And we will be going and talking with them next week and getting an idea of what that's going to look like. But we are asking as part of that to have capacity to be linked to our own private YouTube page. So it's not just words, but there'll be a chance for us to have pictures of us and to be able to do this orally, so people will be able to access it that way. That idea of not having computer access is a problem. So we're hoping that with some of the YouTube that the people will be able to access that on their telephone. So I think it's going to be a work in progress. Sort of the way that we're thinking about this website is in three sort of separate sections. One section will be for our Cobalt and eventually probably our Echo Autism participants. So it will be a password protected site, so there can be discussion boards, places to download data so we can do QI projects. We also want a place for parents so we can give them resources, state but also national resources, and then a place for our family medicine, for any professionals to help get them on board in terms of not only autism but other developmental concerns and state and local resources. So we're very excited, but we're right now still in process. So this is going to be a stay tuned.
Great, yes. I look forward to hearing more from you. We'll get an update from you in another 6 to 12 months.
That sounds great. We'll be happy to provide that.
Great.
So we have a question from one of our attendees who is tuning in from Utah, that they have a lot of services for children in their state, but very few for adults. And so just any thoughts or any way that you have accommodated needs of adults on the spectrum that you might see, especially kind of thinking about employment as kind of a huge issue for adults on the spectrum.
Yeah, that's such a great question, and I will tell you that we are again in the process. I keep that visual image of changing the course of our ship. One of the things that our Kay Baudier, who is in charge of Title V, is very interested in doing is starting to expand for transition services. That we had a transition conference about a month ago looking at how we help educate healthcare providers, but really it was on a job fair. But we are partnering with several different organizations trying to look at that. And quite candidly, I think part of the reason that the Title V people are so happy to work with us is because they're wanting to start to include information about transition services, and they know that they know us, they know that we will help with them with that. So I think right now we're just starting to look at that and how we can create that in our state. And if the individual who's in Utah is interested, they can certainly be in contact with us, and as we continue to develop this, we can certainly, again, give updates.
Great. Well, I see that we are at the end of our hour. I do want to thank again our presenters today for a wonderful presentation on reaching out to rural populations, a number of different exciting activities that are going on in Arkansas. I hope that all of our attendees get ideas of how they might be able to try to adapt some of these in your own communities. Think about how much is being done with very little funding in Arkansas, and I hope that gives you some ideas and encourages you to go out and do similar things for your populations. With that, I'm going to let everybody move on to the rest of their day, and thank you all for tuning in to today's webinar. Have a wonderful weekend. Bye now.
Thank you all so much.
Thank you.